Gauteng's new 500 million rand hospital is currently empty. The facility was supposed to help alleviate the pressure on other facilities and accommodate COVID-19 patients. The DA's Jack Bloom is a member of the Gauteng Legislature, and he joins us now for more on this. Mr. Bloom, thank you for making time. Help us understand here. So 500 million rand was spent. There's pressure in hospitals, but this particular one, which has 155 beds, has only had what? Over 26 patients and only currently has 6?
Yes, that's exactly the case, according to an official reply to my questions of the Gauteng Legislature. Let's start at the beginning. The Anglo-Ashanti gold mine last year offered their disused hospital at the mine to the Gauteng provincial government. The Gauteng provincial government decided to accept this, and then they went ahead and spent 500 million rand, which is a huge amount of money, to refurbish the hospital specifically for ICU beds, because, you know, people die because they don't get specialist care. That's the crying need in our province at the moment. So they actually built 181 ICU beds, except they're the size of ICU beds, but they don't have the equipment. The hospital was officially opened by Gauteng Premier David Makura in May this year with a lot of fanfare, and now in reply to my questions, at the moment they've got 6 patients, which is pathetic. They've got 32 staff, so they've got 6 times more staff than they've got patients, and it's a white elephant. Meanwhile, all our other hospitals are grossly overcrowded, and the 6 patients that are currently at this hospital, they don't even get oxygen. If they need oxygen or specialist care, they have to be transported elsewhere. So I think it's a gigantic fiasco. I think there needs to be accountability, and I'm certainly going to follow up on this. And of course, the SIU is now investigating this because it appears corruption involved as well as with a lot of other things in the Gauteng Health Department. So
what was the point then of spending about 500 million rand here if the hospital is not going to have oxygen? Because I would imagine that the intention was to create the much needed ICU beds for COVID patients.
Well, absolutely. The sensible thing to have done would be to take the 500 million rand, which is a huge amount of money, and to build extra beds at existing hospital and hire extra staff. You know, the problem is we've actually got beds that have that can't be used because they don't have doctors and nurses. So, you know, as we speak now, at the height of this third wave of the pandemic, there are still beds that aren't being used because we don't have enough staff in the Gauteng health system. And here we have a white elephant of a hospital with empty beds and staff 32 staff who I don't think are being used effectively. So really the strategy was wrong. I think that existing hospitals could have done with the extra staff and the extra beds. Instead, we get, you know, all these empty beds in the far West Rand when we need these beds at population centres. That was the other mistake. Why refurbish a hospital in the West Rand when you can do it at you know, more populated centres? This hospital is between Fochville and Carletonville. It's not even in Krugersdorp or in Mohali City or you know, Randfontein, the more populated part of the West Rand, and there's a transport problem. You have to get patients there and back. So frankly, it's just a massive waste of hospital, and I think there needs to be accountability for it.
What's the staff complement at this refurbished hospital? I'm trying to understand if maybe the reason it's not being effectively used is because there are not enough healthcare workers.
Well, I would think that whatever health staff there are shouldn't be used at this hospital. As I said, it doesn't even have the equipment for ICU functioning. At the moment, they've got 32 staff who've just been newly hired. They're going to be recruiting extra staff in the next month. But what's the use of having extra staff at a hospital that has very little equipment? You know, if they need oxygen, they need to transfer them outside. In fact, what the provincial government said some weeks ago is that the only use that this hospital would be used for was quarantine and isolation. And really, you could just hire a hotel for that. Quarantine and isolation is for patients, you know, with a low level of disease, and it's not real treatment. Quarantine is, in fact, they might be exposed to it, but they might not actually have the disease. So here we have an empty hospital when there's a crying need for people to be treated and lives to be saved in the rest of the province.